Mary came to see us already missing teeth. She had had dentures for most of her life, and what she had left was not very aesthetic and not very functional. She came to see us through a seminar, and the information really helped make her decision. We were able to rebuild her bone, rebuild the gum, its tissue as well, so that she could have implants not only for function, but also where they need to be for aesthetics. I think if you look at her before and after pictures and listen to her words and her testimony, I think that will give you a good indication of what we can do as dentists today and the changes that we can make for people.
The first time I even thought about having something done was reading an article in the paper. And it intrigued me because I'd had such trouble with my dentures. I'd worn them for more than 20 years and had to go and have liners every 6 months because they would loosen and fall out. I couldn't even smile. And then when I had a tooth removed, the dentures started to go sideways like this, so that when I smiled, it was lopsided. And I talked to my husband, and he said, go and see what this is all about. So I went to a seminar and was intrigued with it. Going to the seminar and learning about the different things that you can do, whether you have a couple of implants to keep your dentures in place, which was kind of where I was headed. And then looking at the whole and having, teeth in your mouth that you don't remove, and then again going back and talking about it to my husband and him saying, well, why would you settle for half if you could go the whole way? I first came and they told me that it would be 9 months to 18 months for the procedure to go from start to finish. So I arrived in Dr. Bellick's office, teeth in mouth, and started the procedure and went from there. The transformation from having dentures for 20 years to having implants for 3 is as different as night and day. I don't even think of them as implants. They're my teeth. They don't come out. The dentures, you had to take them out at night and they were slipping and sliding and stuff got underneath them, and that just doesn't happen anymore. Your confidence, your self-confidence in knowing that they're not going to drop down if you're smiling or coughing or sneezing and they come out of your mouth. So, like I said, they're my teeth and I don't think anything about them. When I think back to the denture days, they should be outlawed. As far as I'm concerned, it should be part of what we do. I actually do have a friend that needs to have an implant, and we have spoken about it, and she's fearful of the pain because she saw what I went through. And I said to her, having that palate in the roof of your mouth with the tooth attached and having to take that out every time you eat is, you can't compare the two. To having an implant done, it's over and done with. You have a beautiful smile and you can forget about it and put that thing away and not have to take it out every time you eat.